Hey, welcome to DH Vet Animations. Do you know about glanders? Today we will discuss glanders. First of all, we will discuss the introduction. Glanders is a contagious, acute or chronic, usually fatal disease of Equidae caused by Burkholderia mallei, a pathoadaptive clone derived from pseudomallei. It is characterized by serial development of nodules in the upper respiratory tract, lungs and skin. The organism is infectious for people, with a 95% fatality rate and considered a potential bioterrorism agent. Now, we will discuss etiology. Number 1. B. Mallei, a gram-negative facultative intracellular obligate pathogen, is present in nasal exudates and discharges from ulcerated skin. Number 2. Glanders is commonly contracted by ingesting food or water contaminated with nasal discharges of carrier animals' ingestion of meat from affected horses. Number 3. The organism is susceptible to heat, light, and disinfectants. Number 4. A polysaccharide capsule is an important virulence factor and enhances survival in the environment. Now, we will discuss the clinical signs. First, incubation period of 3 days to 2 weeks. Develops septicemia, high fever, weight loss, a thick, mucopurulent, yellowish nasal discharge, respiratory signs. Second, the chronic condition appears with nodular or ulcerative lesions of the skin and internal nares. Donkeys and mules are more severely affected than horses. 3 forms of glanders. Number 1. In the nasal form of glanders, nodules develop in the mucosa of the nasal septum and lower parts of the turbinates. The nodules degenerate into deep ulcers with characteristic star-shaped cicatrices remain after healing. Number 2. In the pulmonary form of glanders, small, tubercle-like nodules, which have cases or calcified centers surrounded by inflammatory zones, are found in the lungs. The nodules tend to break down and may discharge their contents into the bronchioles, resulting in extension of the infection to the upper respiratory tract. Number 3. In the cutaneous form of Glanders farcy, nodules appear along the course of the lymph vessels, particularly of the extremities. These nodules degenerate and form ulcers that discharge a highly infectious, sticky pus. The liver and spleen also may show typical nodular lesions. Here are some pictures of glanders. Now, we will discuss the diagnosis. First step, suspected based on cutaneous nodules exuding honey-like discharge or nasal discharge with ulcers on nasal mucosa. Second step, confirmed by complement fixation test, culture and PCR. Third step, competitive ELISA is more sensitive than complement fixation and may become positive as early as 3 days after infection. Now, we will discuss the prevention and treatment. Number 1. There is no vaccine for glanders. Number 2. Doxycycline, ceftriaxone, gentamicin, streptomycin, and combinations of sulfazine or sulfamonomethoxine with trimethoprim were effective in the prevention and treatment of experimental glanders. Subscribe our channel, DH Vet Animations, for more videos. Thanks for watching this video.